Hi, my name's Chris Lyon, and I'm going to be talking to you today about the healthcare reform policies. We are going to be comparing Minnesota and Wisconsin. What is the purpose of the Minnesota healthcare reform policy? Minnesota implemented their reform law back in 2008. They passed this law with intent of improving the quality of healthcare and reducing costs. The reform law has four main areas, those being population health, market transparency and enhanced information, payment reform, and consumer engagement. They also have three main goals for the healthcare reform. Those goals are to improve the health of the population, to improve patient and consumer experience, and improve the affordability of healthcare. Next, we have the purpose of Wisconsin healthcare reform. The Governor Walker, the Wisconsin governor, placed a reform plan that was approved and signed into law in 2013. And the goals of his plan were first to cut the number of uninsured citizens in half. That means they would have to reduce the number of uninsured citizens by 224,580 people. This plan focused on maintaining current coverage levels for seniors, people with disabilities, and pregnant women who had income up to 300% of the federal poverty level. And next, it gives over 97,000 childless adults living in poverty access to health care coverage. And finally, it also gives adults living in poverty access to private coverage through the marketplace. Some of the similarities in healthcare reform policies, both the Minnesota and Wisconsin programs have the same basic principles that the program was founded on. They are after affordable health care coverages for the citizens, higher quality health care for patients, and also they want to reduce healthcare costs just in general and medical facilities and such. Next, both programs have programs for those with low income who do not have access to coverage. For example, the state of Minnesota has a program called Minnesota Care, and Wisconsin has a program called Badger Care. Both programs require you to pay a monthly premium that is based on your income, and members also have small copays. Finally, both programs have goals to cutting down the uninsured population. Minnesota sets yearly goals. For example, their goal in 2016 was 83,000 people that they wanted to reduce the uninsured population by. And Wisconsin had a overall goal of cutting it in half, which again means that 224,580 people would need to be now insured as a cause of that. Differences in healthcare reform policies. Minnesota has placed a focus on improving the health of their population. They have set aggressive goals to aid the reduction of obesity, tobacco use, alcohol use, and drug addiction within their state. They have set goals to having less than 50% of the population being obese or having any form of tobacco or alcohol use by the year of 2020. Secondly, the state of Minnesota is one of 32 states that have adopted the expansion of Medicaid. Wisconsin is one of 18 states who have not adopted the expansion. This means that Minnesota gives Medicaid coverage to those who are 138% of the federal poverty rate. Wisconsin, on the other hand, only covers 100% of the federal poverty rate. Finally, Wisconsin has implemented a program in 2014, and this program provides over 97,000 childless adults living in poverty the ability to have coverage through Medicaid. And finally is my recommendation to Rasmussen. I would recommend for Rasmussen healthcare systems to expand to Wisconsin based off of my research. The three main points here that I would recommend that off of were, first off, both states had the same basic principles. Again, they wanted to reduce the cost of coverage. They wanted to improve the quality of care, and they also wanted to reduce the cost of health care through medical facilities and such. Secondly, moving to Wisconsin, Wisconsin is working on joining the Medicaid expansion, which means they are looking to also provide that 138% of the federal poverty rate to their citizens and getting more people covered under Medicaid by expanding. And finally, looking at ethical and moral concerns with programs. Most of the ethical and moral concerns that I have found were more focused on the Affordable Care Act program as a whole and not so much the individual policy of each state. So saying between Minnesota and Wisconsin, you're going to find the same basic issues between both of those states and as well as nationwide, due to that being more focused towards the Affordable Care Act and not individual policies.